बिल्कुल स्टार्ट कर देते हैं. Okay, so as you people wanted me to cover the ADHD, so I'll be covering the ADHD. I hope आप में से कुछ लोगों ने ये slides देखी होंगी. Let me open up the chat as well so that I'll be able to see. If you haven't seen these slides, then still I feel that it will be a reference. मैंने कोशिश ये की है कि मैं briefly cover up कर दूं ADHD को. Now the problem is that the ADHD diagnosis varies from country to country. In North America, the diagnosis for the ADHD is very, very commonly made. And most of the children who have symptoms of attention deficit or hyperkinetic are prescribed medication as well. And it's very, very common. I will come to the epidemiology, and I hope I have a slide which will show the epidemiological statistics of ADHD in various countries. In Pakistan, unfortunately, unless or until we see a child with very typical symptoms, we don't make the diagnosis of ADHD. And as Kamran was saying in UK as well, unless or until you are very specific, you don't make a diagnosis. So there is a difference of understanding between ADHD symptoms and treatment in North America and the rest of the world. So in Canada, in US, the diagnosis for ADHD is relatively common, and in other parts of the globe, relatively less common. So we usually don't make the diagnosis very commonly. And unfortunately, when we make the diagnosis, there is another complication that if we make the diagnosis in Pakistan of ADHD, what to do about it? That's another complication. So we'll talk about a little bit about that as well. I hope you are able to see the slides, so I will move on. In between, if you have anything, you just let me know. Now, Wickard describes ADHD syndrome in a German textbook long time ago, right? DSM-2 described hyperkinetic reactions. Then Douglas neurocognitive model of ADHD was studied. So DSM-2 came out somewhere around 50s. So before that, the diagnosis for ADHD was relatively less. So 1775 में Wickard described ADHD symptoms. In 1798, Hoffman cartoons of fidgeting Philip and Johnny Head in the air depicted some symptoms of ADHD. I don't want to go into the history of ADHD, but ADHD-like symptoms described as minimal brain damage in 1940s. And DSM-3 operationalized the diagnostic criteria for ADHD in 1980. So although ADHD was described in 1776, actual diagnostic classification system which involved the appropriate criteria for ADHD diagnosis just came recently in 1980, which was not too long ago, 40 years. So in 1985 to 1995, lots of studies were conducted related to this disorder after it was made officially a diagnostic classification in DSM-3. And after that, they found that, well, there is definitely lots of problem if we see it properly, and then we have to treat it properly. Initially, there were doubts about the treatment as well. So I absolutely remember that in 80s and 90s, when I started practicing, the treatment for ADHD was not at all prevalent in Pakistan. Ritalin की गोली चाइल्ड साइकियाट्रिस्ट उस जमाने में पाकिस्तान में कुछ मरीजों को दिया करते थे because it was a controlled substance and available through a very specific places. So that was the drug launched at that time in Pakistan, and it was prescribed by only hardly, I can say very clearly, that few people across the country in Pakistan. maybe 2 or 3 of them, who were actually the practicing child psychiatrist at that time. Now, fortunately, we have a good number of child psychiatrists, although not the good number, but still relatively much better number of child psychiatrists in the country. So this is a little bit about the history. CDC described ADHD as serious public health problem, and long-acting stimulants were developed. So this is crucial that recently, just few years ago, uh, 18 to 19 years ago, किसी का mic unmute हुआ, if they can mute them. Oops, I'm sorry. Okay, sorry. So very recently, just about 20 years ago, in America, it was said that the ADHD is actually a big problem and it should be treated in children. So that why it was said, there were multiple reasons behind it. The most important reason was that if you really want your children to be academically prosperous and professionally absolutely comfortable, then you should treat this disease very effectively so that the children can grow up properly, they have appropriate attention span, they can study properly, and they can excel in life. Now, this was just in nutshell the summary why it was declared as a serious public health problem, because the outcome of the generation is dependent on the young children who are provided appropriate mental health services, which unfortunately in Pakistan we are still not at this stage. So just recently, 20 years ago, this happened in US. So you can very well imagine how much time it will take in Pakistan to be effectively treating ADHD. So this is unfortunate, but this is true. Now, presentations of ADHD, they say that there are 3 types, right? One is attention type, second is hyperactivity type, and the third is combined. Attention span, when it is compromised, inattentiveness, this is one type. So there are children who are just inattentive, बेध्यान नहीं रख सकते, कोई भी काम करें जल्दबाजी में करें, थोड़ा सा खड़ाका हुआ मुंह दूसरी तरफ देखना शुरू कर दिया, स्कूल में क्लास में बैठे हुए बाहर ग्राउंड में कुछ हो रहा है उस तरफ देखना शुरू कर दिया, टीचर की तरफ से ध्यान हट गया. एक्चुअली आपका टेंशन स्पैन यूजुअली 20 मिनट से ज्यादा नहीं होता. मेरी प्रेजेंटेशंस आमतौर पे छोटी होती हैं. लोग मुझे अक्सर पूछते हैं कि छोटी प्रेजेंटेशंस क्यों. द ओनली रीजन इज that you cannot keep your attention too much absolutely focused for more than 20 minutes. So the best part is that you should try to read or study for 20 to 40 minutes, and after that you should have a break, 5 minutes, and then restart again. So inattentive type of ADHD, easily distracted, unorganized. सो एक चीज यहाँ पड़ी है, एक चीज यहाँ पड़ी है, इस टेबल के ऊपर अगर 6 चीजें हैं तो वो मुख्तलिफ डायरेक्शन में पड़ी हुई हैं और मुख्तलिफ पैटर्न में पड़ी हैं, और जब आपको ढूंढने लगे तो कोई चीज आपको नहीं मिलेगी. डिफिकल्टी इन लिसनिंग, सो आप बार बार अगले को बात करने से रोकते हैं. सो यू ट्राई टू स्टॉप पीपल फ्रॉम कम्युनिकेटिंग. नाउ दिस इज कंसिडर्ड टू बी अ वेरी वेरी बैड gesture in Western world if you stop someone from talking. So usually if somebody is talking, then you have to keep your patience, listen to them completely, and when they are finished, then you have to start. So Kamran can second me that in UK and US and other countries, it is considered to be very much bad manner if you stop somebody in between. In Pakistan, we don't consider it to be abnormal. So we are cutting people very frequently and we don't want to listen to them as well. So अब वो cultural difference है, वो moral difference है, वो ethical difference है, I don't know. I haven't studied that, so I cannot quote that. Maybe there are few studies which will be able to highlight you this phenomena, but that is not the scope of this today's presentation, so I won't go into that detail. But there are definitely differences. Easily distractible, unorganized, and difficulty in listening. it is considered to be inattentive type of ADHD. Then hyperactivity, difficulty sitting still. मैं बैठा हूं, मैं मुसलसल हिल रहा हूं, ठीक है, कभी मैं पेन छेड़ता हूं, कभी मैं कुर्सी हिलाता हूं, कभी मैं आगे आता हूं, कभी मैं पीछे आता हूं. So you can label me adult ADHD. If you want to, it is possible, right? On the basis of this. Difficulty sitting still. Rush through the task. हर काम जल्दबाजी में करना है और जल्दबाजी में इस तरह करना है कि कोई भी काम पूरा सही तरह नहीं होना. Then the last and most important is rush through the task and make rash decisions. गाड़ी चला रहे हैं, सिग्नल येलो हो गया, गुजर गए, right? These kind of incidences are very much unfortunately here in the North America considered to be irrational and part of the hyperactive impulsive type of ADHD. Then there is a combination of both. So you lack attention span and you are hyper as well. And if both of these things combine together, then it is attention deficit hyperkinetic disorder. This is again the whole criteria. So attention span, inattentive, one type, hyperactivity, second type, third, combined type. Diagnostic criteria. एक 12 साल की उम्र से पहले ये symptoms exist करते हो. Usually we say after the age of 3 to 4 and before age of 12. But usually if you have to make an appropriate diagnosis, then you have to start evaluating the child. Now the pediatricians, they see most of the children because of multiple reasons, lack of psychiatrists, lack of education, stigma. People don't go to psychiatrists if the children are having any ADHD symptoms. So they go to the the pediatricians. And the pediatricians usually try to give something to keep the patient calm or keep the child slow. But they never prescribe ADHD medications properly. And again, there are multiple reasons for that. So I don't again want to go into that, but must be present before the age of 12. Be present in multiple settings. अगर बच्चा सिर्फ घर में बदतमीजी कर रहा है, then you have to consider other situations. But if the symptoms are persisting at home and at school, or when you take the child to somebody's place and the symptoms are there as well, multiple situations, then it is considered to be ADHD. In one single situation, like just at home, he is inattentive, he is not listening to the parents, he is hyper, he is breaking the things, he is disorganized, we won't consider it. But if the similar kind of reports are available from the school as well, we will definitely consider the ADHD. Interfere with or reduce daily functioning. So the output is compromised. So the child is not able to score successfully. 30 की क्लास है और ऐसे बच्चे आमतौर पे लास्ट 5 पोजीशंस पे रहते हैं. 25th, 26th, 28th position आ रही है. Now parents are not bothered about it, that their children are doing poorly in the class. Surprisingly, the teachers are not bothered as well. They are considered to be, oh yeah, hanji, hai aisa. That is not the situation. As a psychiatrist, we have to understand कि कोई भी ऐसा नहीं है. ऐसा है अगर तो कुछ ना कुछ मसला है, and we have to correct it, unfortunately, but we don't consider it. Not be better explained by any other medical or mental or health condition. So you have to rule out the possibilities of pervasive developmental disorders, conduct disorders, and other related disorders. We will talk about the differential diagnosis soon. What are the signs? So those were symptoms, right? And now the signs. Easily distracted. So little bit of sound in the room and the child will start looking at it. Appears withdrawn. They are just sitting at one place and not communicating properly. Forgetful, hyper talkative, talks too much. Exaggerated emotional response. थोड़ा सा कह दिया बैठ जाओ, रोना धोना मचा दिया. थोड़ा सा कह दिया खाना खा लो, रोना धोना मचा दिया. So signs and symptoms of ADHD, just remember some of them. In children, taking a long time to complete the assignments, trouble staying on the task, difficulty sitting still. In adults, trouble listening during conversation, becoming bored easily, and taking long time to complete the task. That is important, right? Okay, moving ahead. Common characteristics of ADHD without hyperactivity in children. Sorry, I have to correct this. It is where it is. Okay, right. So be prone to dreaming or forgetfulness. अब ये again daydreaming. Daydreaming is considered to be very much a good thing in some cultures and some text, but daydreaming is considered to be very problematic if you are evaluating children for ADHD and other childhood disorders. अपने ख्यालों में गुम होके वो ख्याली पुलाव पकाते रहते, वो कहानियां बुनता रहता है अपने दिमाग में, परिस्तान की, फ्यूचर की, हैरी पॉटर की, things like that, and they are lost. Now, in some cultures, it is considered to be normal. When children are like that, they do daydream, they do have fantasies, they do think like that. But if you are studying ADHD or if you are evaluating people for ADHD and if they are having symptoms, some of the symptoms which I have mentioned earlier, then this is a problem. Show schoolwork, desk or locker that looks disorganized. ये जो आपको लॉकर नजर आ रहा है, ये अलमारी नजर आ रही, कागज के टुकड़े पड़े हुए अंदर, ठीक है, कपड़े उल्टे सीधे पड़े हुए हैं. अक्सर आप ये कॉमन फिनोमेना नजर आएगा, बच्चों ने कपड़े उतारे वहीं फेंक दिए, टॉवल उतारा वहीं फेंक दिया, गीला हो रहा है, माँ जा रही है, चीजें समेट रही है, चीजें साफ कर रही है, खिलौने इकट्ठे कर रही है. Now, these things are considered abnormal if you look at them, and they are not abnormal if you won't look at them. आप कहेंगे जी ये तो सारे घरों में होता है. सारे घरों में नहीं होता, ये कुछ घरों में होता है, और जिन घरों में होता है वहां पॉसिबिलिटी ऑफ ADHD को आप कंसिडर करें उन बच्चों में. And that is the difference. Why this is the difference in North America and rest of the world. Because the other places this is considered to be a normal thing for children, but in North America it is considered to be abnormal thing. So they should clean their rooms, they should put the things properly, they should be able to, so it is something compulsive, that it is expected out of norm that they will do that. And if they are not doing it, then they need ADHD treatment, so, or evaluation. Then appears to be bored or disinterested in classroom activities. Teacher पढ़ा रहा है, आप ख्याली पुलाव बना रहे हैं. Lose materials, misplay assignments or fail turn in assignments. So this is unfortunately again a problem. बच्चे, मैंने जो कहा आखिरी 5 पोजीशन में मुसलसल आ रहे हैं. क्लास 2 में भी 26वीं पोजीशन थी, क्लास 3वीं में 30वीं पोजीशन थी, क्लास 4th में जो है वो 28वीं पोजीशन थी. वो मुसलसल टेल एंड पे है, और अकॉर्डिंग टू एनी स्टैंडर्ड्स अगर वो 2 स्टैंडर्ड डेविएशंस के बाहर फॉल कर रहा है, बट वी आर नॉट फोकसिंग इट. सो इफ वी रियली वांट टू असेस, then it should come from the schools, it should come in the report cards, and people should consider it seriously, but we don't. That is unfortunately the problem. 6 signs of ADHD in adults and child. Has trouble listening, avoids doing activities that require sustained effort, struggles with organization and time management, can't sit still, talks or interrupts excessively, and frequently loses belongings. So that is one. Then ADHD includes imaginative, jittery, independent, creative, chaotic, scattered, social, confused, generous, inspired, charming, forgetful, bubbly, disorganized, impulsive, messy, distracted, kind. Now you see, if you look at these words, they are ADHD. बच्चा बहुत खुश मिजाज था, लेकिन बहुत चीयरफुल था, लेकिन बड़ा जज्बाती था. बच्चा बहुत अच्छा था, सबके साथ उसने अपनी कैंडीज शेयर की, लेकिन बच्चा अजीब परेशान सा लगता था, right? So at one end it's generous, at other end he's confused, at one end he's chaotic, at other end he's inspired, at one end he's jittery, at other end he's charming. So if you consider these words, they are the key for the evaluation of ADHD. Remember this slide and remember these words. You will never forget ADHD. Now, ADHD is comorbid with multiple things. Some of them are mentioned here. So depression, problems, concentration and loss of motivation, conduct disorders, impulsive type, oppositional defiance disorder, loses temper, argumentative, anxiety, inattentive, fidgetiness. So अब इनके डिफरेंसेस हैं थोड़े थोड़े. फीलिंग सैड और होपलेस और सुसाइड. बच्चे को अगर अफसुर्दगी, रोना बार बार आता है, it should be considered seriously, and childhood depressive disorders should be considered in differential diagnosis. Again, no regard for consequences. बिल्ली को दुम से पकड़ लिया, कोई डर नहीं लगा, ग्राउंड में फिर रहे थे, वो फ्रॉग नजर आ गया, उसको पकड़ने की कोशिश की. So things like that, and they are not fearful about the consequences. सड़क पे भाग रहे हैं, चलते जा रहे हैं, साइकिल चला रहे हैं, इधर से गए उधर से निकल गए, लोग बचाने की कोशिश कर रहे हैं, वो खुद नहीं बचाने की कोशिश कर रहा. So without any consequences. सीढ़ियों से भागते हुए उतर रहे हैं, पता है इतनी तेज चलेंगे, स्लिपरी सीढ़ियां, गिर जाएंगे, but not bothered. Then anxiety में pounding heart, difficulty breathing, persistent intense fear or worry. Now, the best and most problematic is oppositional defiance. Blames other for own mistake. मैंने थोड़ी किया, ये इसने मुझे कहा था, मैंने कहा. So always trying to find an excuse कि मैंने नहीं किया, उसने ये कहा था या उसने ये कर दिया. क्लास में, घर में, भाइयों पे ब्लेम लगा देना है, बहनों पे ब्लेम लगा देना है, क्लास में अपने क्लास फेलोज पे ब्लेम लगा देना है. And we don't consider it abnormal, unfortunately. It is something alarming if you are really considering the psychiatric diagnosis. Refuses to comply with rules. And these questions, if we won't ask the parents, we will miss the diagnosis. Impact of untreated and undertreated ADHD. Now, this is what I was telling you in the beginning, why it was considered to be important, right? So 1989 में ये स्टडी छपी थी, उसके बाद subsequently इस पे मजीद काम हुआ और फिर ये कुछ फैक्टर्स डिमार्केट किए गए. हेल्थ केयर सिस्टम, 50% increase in bike accidents, 33% increase in emergency visit, 2 to 4 times motor vehicle crashes. School and occupation, 46% expelled, 35% dropout, lower occupational status. Then society, substance use, सिगरेट पी रहे हैं, अब तो खैर पाकिस्तान में भी मैरिजुआना लीगलाइज्ड हो गई, सो फर्दर increase in substance abuse disorders. Earlier onset, less likely to quit, and employer parental absenteeism and reduced productivity. If somebody is not regular in his work, I will always consider a psychiatric morbidity. जब मैं पाकिस्तान में भी डिपार्टमेंट में गैर हाजिरियां लगाता था और लोग लेट आते थे या लोग जल्दी भाग जाते थे या बीच में से गायब हो जाते थे, तो जरूरी नहीं कि वो बुरे हैं, बट उनको कोई ना कोई साइकियाट्रिक मॉर्बिडिटी है. और मैं अक्सर ये डायलॉग बोला करता था, आई मे बी रॉन्ग, इट इज मे बी deviated dialogue. I now regret that what I was saying, but I still remember that I used to say कि इन सब को फ्लोक्सेटिन पानी में मिला के पिलाएं, ठीक है? Because if you are absent, if you are late, if you are not productive, if you are having problems with the social relationships, you feel everything is okay. This is norm. This is okay. It is not norm and it is not okay. Okay, so ADHD, distractible, hyperactive and impulsive, high stimulation seeking, problem solving and prioritizing, difficulty following through, put things off, poor listening skills, disorganized, poor time management, and distractible all of these symptoms are ADHD. Now, this slide is important, right? Okay. Sorry. मैं कहाँ था? Oops. Okay. यहाँ था. मैं just. Okay. Can you see me? Anybody?
No, sir, I can't see you.
Sharing the screen.
Okay. Can you see me?
No,
Yep.
sir.
But slide नजर आ रही है ना? आप डिस्कनेक्ट अगर हो जाए तो मुझे मैसेज कर दें, राइट?
नहीं सर, आपकी स्क्रीन नहीं आ रही अभी.
Okay, okay. So we are good to go, right? Okay. So going back, okay, slides share करें. So this is overall epidemiology and male to female ratio of ADHD. In Austria, 16, Denmark, 10, Switzerland, 8, France, 7, Italy, 6, Netherlands, 6, UK, 6, Germany, 4, Iceland, 4, Norway, 3. This is female and males are all 1. So it is more common in girls than it is in boys. This is what these studies indicate. Children and adolescents with ADHD, male to female prevalence. Sorry, blue is male and pink is female. So it's more common in males than in females. So डेनमार्क में आप देखें जी, हर 10 लड़के को ADHD है और एक लड़की को ADHD है. Now, I definitely asked myself this question: is this study really valid, or there is some loophole in it? And then I tried to correlate it with the number of the population actually. So in Denmark, the population and the male to female ratio is definitely skewed at one end. So I have to see if this is okay or not. But anyways, these are the statistics available in the literature. Life at school, 45% compromised. Daily life and activities, 35% compromised. Social life, 34% compromised. Life at home, 31% compromised. So all of these social parameters are compromised in ADHD. ADHD by the number, 6.1 million American children have ADHD. 6.1 million American children. It's a huge number, huge number. I think it's 10 to 12%. 5 in 10 children with ADHD have a behavior or conduct problem. 4.4% of American adults have ADHD, and 62% of children with ADHD take medications. So now imagine, out of 6.1 million, 62% are on medications. पाकिस्तान में तो डिप्रेशन में दवाई लोग नहीं खाते, इतनी अच्छी फिगर्स नहीं है जितनी यहाँ पे. So this is again something that needs to be addressed, and we have to be careful about it. Children currently diagnosed with ADHD ages ranges from 4 to 17. 4 से 10 साल की उम्र में हर 15 में से एक. Again, हर 15 में से एक. It's again a big number. 11 से 14 हर 9 में से एक, और 15 से 17 हर 10 में से एक को ADHD है. ओवरऑल हर 11 में से एक को ADHD है. इस हिसाब से पाकिस्तान की पॉपुलेशन अगर मैं 20 करोड़ लगाऊं तो 20 करोड़ की आबादी में से कम से कम नहीं तो कितने, 1.5 करोड़ को ADHD है. Probably. Just calculate. It's a big number. And we don't see ADHD with that parameter in Pakistan at all. So we have to be careful. Attention deficit hyperkinetic disorders, pathogenesis, and clinical features. This slide is too important. The reason, because it explains everything related to the brain and related to the pathogenesis. So genetics plays a large impact. Premature delivery is definitely a contributing factor. Premature delivery is common. Significantly low birth weight is a problem. Postnatal injury to the prefrontal regions of the brain is another pathology. So अगर इम्तिहान में etiology of ADHD पे सवाल आ जाए तो ये एक स्लाइड कवर कर लेगी सब कुछ. Genetics, premature delivery, significant low birth weight, postnatal injury to prefrontal regions of the brain, difficulties during pregnancy, prenatal exposure to alcohol and tobacco, excessively high body lead levels, impaired brain development in utero. Then all of these factors combined together coming down, dysfunction of dopaminergic activity in prefrontal cortex, dysfunction of adrenergic activity in the locus ceruleus, altered neuron activity in cortical regions involved in attention, impulse control, and stimulus integration abilities. I hope I'm not too fast. But remember, this slide is very important if you get the question in exam. These things, just mentioning them, you will secure good marks. So dysfunction of dopaminergic activity in prefrontal cortex, dysfunction of adrenergic activity in locus ceruleus, altered neuron activity in cortical regions involved in attention, impulse control, and stimulus integrated abilities, ADHD. Hyperactivity, impulsivity subtype, inattentive subtype. Increased risk for future substance abuse, increased risk of high risk behaviors, and increased risk of school problems. So starting from genetics, coming down to the risk. The symptoms on the sides of impulsivity, inattentiveness, and hyperactivity, we have talked for most of them, so I won't go into that detail. But this slide is important and the key. Preschool children and adolescent parents and teachers, DSM-5 or ICD-10 diagnosis of ADHD. Preschoolers, when available, use evidence-based non-pharmacological treatment. First, for severe symptoms, medication is indicated. Okay, I'm still there? Yes. Okay. So with comorbidity, without comorbidity. With comorbidity, mania, psychosis, contraindications for stimulants, depression, tics, anxiety, substance use, etc., etc. Learning disabilities are common, and cardiovascular, seizure, and potential contraindications for stimulants. Now, this slide is probably out of proportion here, but the reason why I wanted to show this is that to make sure that you understand that the pathogenesis needs to be treated properly. If a patient reports, alludes to, or exhibits signs or symptoms in one of the three categories, affective, behavioral, cognitive, inquire about symptoms in the other categories. Are they consistent with the diagnosis of ADHD? If yes, obtain collateral information. If no, consider alternative diagnosis. This is just a flow chart to mention कि अगर बच्चा लेके आपके पास वालिदैन आए तो आपने डिफरेंशियल डायग्नोसिस में अफेक्टिव, बिहेवियरल और कॉग्निटिव चीजों को असेस करना है. If you have some clue that it's going towards the diagnosis of ADHD, then you have to ask questions related to ADHD. Then you take collateral information. So the most common scale used for ADHD in Pakistan is Conners, and Conners is usually done by the parents and the teachers, both. So that is important if you consider it there. Multiple early risk factors contributing to development of ADHD, as I mentioned earlier: genetics, early environment, ADHD, later risk and protective factors, modifying family, etc., etc. So heterogeneous, this already covered. Disorders specific to ADHD pathophysiology: inferior dorsolateral prefrontal cortex, top-down cognitive control. Lateral orbital and ventromedial prefrontal cortex, top-down effect and motivational control. ये slide, if I try to explain it, it will take me hours. So I am not going into that detail. But if I'll have some time later on, I will do that. But for the time being, just remember these brain areas, and then we'll see. Sorry, oops, 4 emails. Okay. Basal ganglia, fine-tuning selection, motor, cognitive, emotional, parieto-temporal, attention span, temporal lobe, aggressive performance monitoring, amygdala, emotional processing, and other areas of the brain. Treatment choices. Now, coming almost to an end. First line therapy. In Pakistan, unfortunately, this is all theoretical for you people because most of the things are not available in Pakistan. So मैं पहले theoretical aspect cover कर देता हूँ, फिर मैं पाकिस्तान का perspective बता देता हूँ वहाँ हम क्या करते हैं. Does patient have or contraindication or inadequate response to stimulants? No. Begin stimulant regime at lowest possible initial dose. Monitor the side effects. Can patient swallow whole tablets? Yes. Short acting 3 to 6 hours. Amphetamine, dextroamphetamine, methylphenidate, dexmethylphenidate. Intermediate and long acting 3 to 12 hours. Methylphenidate extended release. Short acting 3 to 5 hours. Methylphenidate liquid. Intermediate long acting amphetamine extended. Lisdexamphetamine, dextroamphetamine, methylphenidate, and dextromethylphenidate. If there is an allergy to stimulant or some problems with it, then patient is either hypersensitive to atomoxetine, taking MUIs, experiencing glaucoma, pheochromocytoma, or severe cardiovascular disorders, we will just give atomoxetine. But if the patient is not having cardiovascular disorders and is not responding to atomoxetine, then you go for guanfacine and clonidine. These are 2 drugs. Now, coming to the Pakistan situation, what do I do? Unfortunately, in Pakistan, we don't have any of the first line drugs mentioned here. Stimulants, none of them. Even Ritalin, we are not able to find it. So, first line is out. Now comes the second line. We have atomoxetine, available only by one company and available only in 10 milligrams capsule dosage, which is difficult to administer to children. So capsule form में बच्चे को अगर 6-7 साल का है तो खिलाना मुश्किल हो जाती, मुसीबत हो जाती रादर. So फिर क्या ऑप्शंस हैं? पाकिस्तान में लोग एंटीसाइकोटिक प्रेफर करते हैं. Risperidone, olanzapine. It's unfortunately absolutely inappropriate for the treatment of ADHD. अभी जो मैं पैथोफिजियोलॉजी आपको बता रहा था उसके हिसाब से एंटीसाइकोटिक तो केओस फेर देंगे उस पैथोलॉजी पे मजीद. सो एंटीसाइकोटिक में भी जो दवाइयां रूटीन में दी जाती उसमें रेस्पिरिडॉन दी जाती, which is unfortunately absolutely inappropriate to treat ADHD symptoms. अगर आपके पास ऑप्शन है एटोमॉक्सिटीन की तो वो दें. कुछ पेशेंट्स मेरे कैटाप्रेक्स क्लोनिडीन अरेंज कर लेते हैं. 0.1 मिलीग्राम की टैबलेट अवेलेबल है मार्केट में, मिलती मुश्किल से पर मिल जाती है. और कैटाप्रेस क्लोनिडीन 0.1 milligrams can be given up to certain dosage. Guanfacine, again, it's not available in Pakistan. So we have just 2 options. One option is atomoxetine and second option is the catapres, if available. There is no other option, which is unfortunate, but it is true. हम अपनी generations को खराब होते हुए देख रहे हैं, हम treatment नहीं देना चाहते. 10 rules for parents of defined kids with ADHD. 1. सबसे जरूरी है वालिदैन को हौसला देना. So I will just read the points. वालिदैन को आपने कहना जी stay positive, treat before you punish, use your words, avoid meltdowns, act like a cop, be clear about rules and consequences, play before punishing, know your child's patterns, determine the true cause and ask yourself if you are the contributing factor. अक्सर वालिदैन इस चीज को अंडरस्टैंड नहीं करते. 6 ways to retain focus. Get it in writing. Make sure your child sits in the front row. Ask to review. Avoid fatigue. move a lot and choose your leader very, very carefully, which we don't. So no HD, ADHD or ADHD. You see the difference. नो ADHD, बच्चे ने तस्वीर बनाई है प्रॉपर आदमी की, लेकिन कलरफुल नहीं है। ADHD के बच्चे ने तस्वीर बनाई है, तस्वीर बड़ी गलत है, लेकिन बहुत कलरफुल है। That's the difference. So if we take it positively, then it's good. If we don't take it positively, then it's bad. Okay, ji, this was the presentation. Now, if there are any questions, I am willing to respond to that. कोई सवाल नहीं? हाँ,
सर जो
बोलो।
क्लिनिकली एंटीसाइकोटिक्स प्रिस्क्राइब की जाती हैं तो उसके क्या इफेक्ट्स हो सकते हैं इन बच्चों पर?
वो जो स्लाइड मैंने आपको दिखाई थी ना पैथोजेनेसिस की, उसको अगर आप थोड़ा सा रिव्यू करें, मैं दिखाता हूं आपको दोबारा। जो की स्लाइड आपको दिखाई, ये डिसफंक्शन ऑफ डोपामिनर्जिक एक्टिविटी इन द प्रीफ्रंटल कॉर्टेक्स, राइट? आप एंटीसाइकोटिक दे के क्या कर रहे हैं? ब्लॉकेट कर रहे हैं। फिर क्या होगा? यहाँ पे जरूरत ब्लॉकेज की नहीं है, यहाँ पे डिसफंक्शन है, मींस प्रोपोर्शन खराब है। सो आप उस प्रोपोर्शन को या उसको स्ट्रीमलाइन करने को आप और खराब कर देंगे। सो ADHD वर्स हो जाएगी, एक्चुअल में उसका अटेंशन स्पैन खराब हो जाएगा, लेकिन क्योंकि वो टोन डाउन हो जाएगा, स्लो हो जाएगा, तो पेरेंट्स कहेंगे जी फर्क है। सो ट्रीट करने में और टोन डाउन करने में फर्क है। सो एंटीसाइकोटिक देने से आप स्लो तो कर देंगे, लेकिन कंसंट्रेशन स्पैन, अटेंशन स्पैन, हाइपर एक्टिविटी को रोक नहीं पाएंगे।
राइट सर,
ठीक है, और दैट्स इट। चलो, थैंक यू वेरी मच। इट्स गुड टू सी, वेरी टाइमली। मैं 45 मिनट्स में खत्म कर दी, ज्यादा देर नहीं लगी। मेरा ख्याल था कि स्लाइड्स ज्यादा हो जाएंगी। Make sure that whatever you want to study about ADHD, it's a very, very lengthy topic, but मैंने कोशिश ये की थी कि मैं differential diagnosis की एक स्लाइड pathogenesis और etiology की, एक स्लाइड epidemiology की और symptoms की कवर कर दूं। अगर इसमें फिर भी कोई बात हुई, मुझे क्वेश्चन पूछ लेना। Right? Thank you very much, everyone. If there is no more question, then we'll end.